So you need to know a patient with erectile dysfunction where cyclic AMP, direct smooth relaxation, is the function of alprostadil. Similarly, the PDE5 inhibitor, which is used to treat the erectile dysfunction, is sildenafil. And the one which is given as the intracavernosal injection therapy for the erectile dysfunction is alprostadil. And the patient develops flushing and headache because of the increased cyclic GMP mediated vasodilation. It belongs to PDE inhibitors, is what you need to remember. Is the voice clear or any resound is coming? Manu, can you please check? Yes. Nice to see Satvik and many more. What are the risk factors for the DVT except? Punch your loud answer, doctor. Yes. What are the risk factors except? In order to listen the voice, please click on the video twice, right? Yeah. If you're on mobile phone. So we need to know, very good. Satvik rightly answered. Whenever a post-operative patient develops a calf pain and swelling, think of only DVT. And oral contraceptive pills is one of the important predisposing factors to develop the DVT. And a patient with DVT develops sudden chest pain, sudden dyspnea, think of the possibility of the pulmonary embolism is what you need to remember. Now, in herpes encephalitis, all these are true, except what? In herpes encephalitis. Is it the temporal lobe involvement or MRI or focal symptoms or EEG? Punch your answer, doctor. Yes, nice to see Satvik being online. Yes. So Satvik is absolutely right. EEG is not diagnostic. Is wrong, fundamentally, right? So you should know any patient who presents with fever, seizures, altered sensorium, you should always think of the possibility of the temporal lobe involvement. MRI show hyperintensity in the temporal lobe. EEG show periodic lateralized waveform discharges, which are classically seen in HSV encephalitis. Acyclovir is the treatment of choice. Whenever focal neurological deficit is there in encephalitis, it suggests the involvement of the temporal lobe is what you need to basically remember. Now, medulloblastoma most commonly metastasizes to the CNS is what you need to remember. Yeah. So, whenever there is a child with posterior fossa tumor, there are drop metastases into the spinal cord. You need to diagnose the medulloblastoma. A midline cerebellar tumor, especially in children, the most common reason is medulloblastoma is what you need to remember. And a tumor that metastasizes through the spinal fluid, drop metastasis they are called, is the medulloblastoma. And medulloblastoma pathologically is a small round blue cell tumor is what we have to remember, histology. Now, doctor, narcolepsy is due to the abnormality in the which part of the brain is the question. Is the broadcast loud and clear? You can be able to type into the chat window, doctor. Is it loud and clear? You can type into the chat window. Yes. So let us see. Satvik rightly answered. Satvik is standing on the top with 12 marks. Hypothalamus, absolutely. Narcolepsy, hypothalamus. NEET PG 2012 question. So whenever there is an excessive daytime sleepiness, thank you, Satvik. Yes, sir, all good. So excessive daytime sleepiness, cataplexy, you need to think of narcolepsy. Narcolepsy is associated with the deficiency of orexin, and orexin is being produced in hypothalamus, and the sudden loss of the muscle tone is characteristic of the cataplexy. And what is so characteristic, doctor? Sleep onset REM without NREM is characteristic of narcolepsy. Now, what is the principle of Chinese medicine? Once upon a time in 2013, this is the question, cheapest question nowadays. Such cheap questions are not asked. Yes, good to see Satvik, Nitin, everyone being online. So you need to know, doctor. Very good. It is the yang and yin, both of them, right? So I straight away go to the next question. Thrombosis is most commonly associated with which site if you happen to put a central venous pressure catheter is an important question of the examiner. What's your answer? Thrombosis, most commonly. So the first topic in the entire general medicine, high-yield topics. There are totally 53 high-yield topics. First is clinical case-based medicine, on which a lot of questions are asked. Very good. Satvik did it wrong. He thought it as a subclavian vein, but it is the femoral vein is what you need to remember. So whenever a central venous catheter develops swelling of the limb, you need to think of femoral vein thrombus. And it is the endothelial injury which is caused by the catheter that lead to hypercoagulability and a clot formation in the femoral vein is what you need to understand. Now, erlotinib is used in every NEET PG you go. One MCQ definitely comes from the monoclonal antibodies. You need to be very sure about. So let us see Nitin, Satvik, both being online. Yes. Sure, doctor. So let's see what is your answer. Satvik rightly answered, surprisingly, so good. Pancreatic cancer is what you need to remember, right? Now, so whenever pancreatic carcinoma is there, if you are using a epithelial growth factor receptor inhibitor, it is erlotinib. Erlotinib. And in the lung cancer, we use tyrosine kinase inhibitors. And whenever there is any mutation in the EGFR which is being found, then you need to use erlotinib is what we have to emphatically remember for the tomorrow's NEET PG. Now, NSABP typically stands for what? So you should know some silly questions way back in 2013 NEET PG exam. Yeah? This kind of questions, if you are sure you answer, otherwise leave it, especially with the negative marks. So you should know. Good. Even this question, Satvik rightly answered. National Surgical Adjuvant of the Breast and Bowel Project is what you need to remember. So, next question. In a patient who has got a high clinical suspicion of pulmonary embolism, what is the best investigation that you want to do is an important question. Yes. What is the best investigation you want to do? right? So let's see. Good. Satvik rightly answered. Nitin also correctly answered. It is the CT angiography which is considered to be the investigation of choice. So D-dimer is used, but it is a screening test. Gold standard means catheter angiography. And whenever leg swelling is there and you want to evaluate DVT, color Doppler is what you should remember. Whenever massive pulmonary embolism is there, there's an increased pressure in the pulmonary artery, which puts a pressure on the right ventricle that leads to right ventricular failure, leading to the development of the shock and sinus tachycardia, S1, Q3, T3 pattern, which is there in the ECG, which is a very classical feature. Now, quicken slit test is done. In which case? Where will you do? Quicken slit test was the 2013 NEET PG question. Quicken slit test is done for. Let's see who is right. So, Satvik missed it. Oh my God. You thought it for glomus tumor? No, doctor. It is for the CSF rhinorrhea, is what you have to remember. Whenever you want to detect a blockage in the spinal subarachnoid space, you call Queckenstedt's test. So, whenever there is an ECS of rhinorrhea, it presents with a clear nasal discharge. And meningitis is one of the important complications of CSF leak. And whenever there is any head injury, watery nasal discharge, you want to confirm CSF rhinorrhea, then you need to basically use beta-2 transferrin. So Satvik is proposing acoustic neuroma. Can it be possible? We will check that. It's a good point. Yes. Nitin, Satvik, Kota, Manu, come on, let's see. 55-year-old, undigested food, vomiting, history of dysphagia, emaciated, dehydrated. How do you want to manage is the favorite question of the examiner. Nice to see Madan Kumar and many more who are all online. Please click Madan on the video to listen the audio, right? Yes, very good. So, it is the endoscopic dilatation whenever there is any stricture. So any progressive dysphagia to both solids and liquids, you think of achalasia. And if it is achalasia, the lower esophageal sphincter is not ready to relax. So you need to do endoscopic dilatation. And if you do manometry, which is considered to be the gold standard in achalasia, there is a failure of the lower esophageal sphincter. Relaxation is a classical feature. And achalasia, one of the complications you should remember is esophageal carcinoma. And bird beak appearance and achalasia, unforgettable. Right? Now, these are all the common sites which are primary for the bone metastasis, except Manasa and many more who are all online. Yeah. Yes, doctor. So these are all the common sites of the Good. So Satvik and Nitin correctly answered, even Manu also correctly answered. So breast, brain. The common primary tumors metastasizing to the bone include breast, prostate, and lung. Brain tumors typically metastasize to bone? No. The most common bone metastasis pattern is osteolytic pattern. Where do you find osteoblastic metastasis? Prostate cancer. And whenever there is any bone pain, pathological fracture, think of metastasis as the underlying cause is what you need to remember. Now, what is the common deformity in Chiari 2 malformation is a very important question. Let's see who will correctly answer. Common deformity in Chiari 2 malformation. So, doctor, good. Satvik and Manasa rightly answered. Syringomyelia, meningomyelocele, hydrocephalus, they're all the deformities associated is what you need to remember. So, Chiari 2 malformation is commonly associated with meningomyelocele. And we also find syringomyelia. And cerebellar tonsils will herniate in case of Arnold-Chiari malformations. Whenever there is any spinal defect with the hydrocephalus, tomorrow in the NEET PG exam a question comes, you should be able to answer it as Chiari 2 malformation is what you need to remember. Now, so the radiological view, which shows maxillary sinus and orbit is which view? Waters view. So for the maxillary sinus, Waters view, frontal sinus, Calvel view, lateral skull for Sella turcica, Townes view for occipital bone, and the fracture of the orbital floor, we use Waters view. These are the standard things that you need to remember for the tomorrow's NEET PG exam, doctor. Now, 20-year-old female with primary amenorrhea, with normal presentation of everything except no axillary hair, no pubic hair. What is your diagnosis, doctor? This is one of the traditional classical MCQ which occur because of a receptor level resistance. Yes, let us see who is going to be the correct answer. So, a very important clue. Satvik rightly answered, very good, 38 points. And most of you did wrong. So you should know, absence of axillary and pubic hair is androgen receptor insensitivity syndrome, which is also called testicular feminization syndrome, where phenotypically they look like a female, but genotypically their karyotype is 46XY, is what you need to remember. So whenever there is any breast development, absent uterus, you need to think of the possibility of androgen insensitivity syndrome is what you need to remember. Good to see Chandni. Can you please punch Chandni? Is the voice loud and clear? You need to click on the video, tap on the video to listen the audio, right? Yeah, keep punching your answers, doctor. Chandni, can you please type and text whether the voice is loud and clear for you in addition to video? Yeah. Obstructive sleep apnea. Yes, sir, it is clear. Good, thank you. So, which is not true about obstructive sleep apnea? So, he's going to give me the correct answer. Very good. Nitin and Satvik are standing on the top of the leaderboard. Yeah. So, you will get bored if you happen to listen to a lecture, but live, if you are answering, you will remain patent. Gold standard for obstructive sleep apnea is polysomnography. They present with snoring. They present with hypertension. If alcohol consumers, that will worsen the sleep disorder, obstructive sleep apnea. And because of continuous interruption of the sleep with the apneic episode, they will be presenting with sleepiness in the morning. So obstructive sleep apnea is the NEET PG examiner's favorite area. Now, doctor, 13-year-old female having sudden onset of high-grade fever with delirium, typically limbic system, medial temporal lobe is involved. Very important clue. What is your diagnosis, doctor? Favorite question of the examiner. Punch your answer. Good to see Nitin, Chandini, Manasa, Satvik, everyone being online. Good. So, you need to know Satvik is right, Nitin misread, Chandani, very good. So, herpes simplex encephalitis once more. So it is the temporal lobe involvement using the acyclovir because it is a viral encephalitis. If you take out the CSF, you get lymphocytosis, and if you don't treat, it can lead to mortality, is what you need to understand. Now, doctor, the most common nerve which is damaged in CSOM was the NEET PG 2014 MCQ. So what is your answer? Most common nerve to be damaged whenever there is a CSOM. Yeah. So let's see who is going to be the correct answering. Yes. Very good. Satvik is right. Manasa is ascending up the ladder. Also the Chandani. Very good. So it is the CSOM commonly affects facial nerve that lead to facial asymmetry, and CSOM can lead to brain abscess. Whenever there is any ear discharge with facial paralysis, only think of CSOM and its complication. And House-Brackmann's grading is typically used for the degree of facial palsy, is what you need to remember. Now, doctor, C1 esterase inhibitor deficiency. Very, very easy question. Yeah, all of you should answer this correctly. Yes. So, Manasa rightly answered with +4. And yeah, so it is called hereditary angioneurotic edema. So whenever any patient is presenting with recurrent episodes of non-pitting edema without urticaria involving the face and airway, think of hereditary angioedema. And what is the drug which is used to treat acute episodes of hereditary angioedema? It is icatibant, which you need to remember. And there are two pathways, classical alternate. Which pathway is affected in hereditary angioedema? It is the classical pathway, which you need to remember. Good to see Dr. Sanjay, who is online. Excellent, doctor. Yes. Please tell your friends also to join. And Sanjay, can you be able to listen the voice? You need to click on the voice, on the video, to listen the voice. Yeah. Please let me know, is the voice loud and clear for you? Thalidomide is used in the case of 2014 NEET PG PYQ. Yes. Let's see. Very good. Only two of you correctly answered multiple myeloma. Satvik and Manasa, very competitive. Let us see who is going to win. So Manasa joined a little late. Yeah. The patient with plasma cell malignancy, we give the immunomodulatory drug, thalidomide. So what is the main mechanism of thalidomide? It is anti-angiogenic in nature. And what is the major side effect of using thalidomide? Neuropathy. And thalidomide exposure in pregnancy can lead to phocomelia. And what is that skin condition where thalidomide is used? Erythema nodosum leprosum is the place where in leprosy type 2 reaction we use the thalidomide. A middle-aged male complains of ache and numbness and sensation of the fatigue in the calf muscles. And what is this condition due to, doctor? Not associated with. It is more on exercise and relieved on rest. Very important clue. Who is going to give me the correct answer? Yes, doc. Middle-aged male complains of ache and numbness. So it is not hypocalcemia, but rather smoking, peripheral artery disease, hypertension, diabetes. Any of them can be associated, is what you should remember. So intermittent claudication is the classical feature associated with peripheral artery disease. And how do you quantitate it? We do ankle brachial index, where you can be able to see 0.9 is a gold standard value. Less than 0.9 indicate peripheral vascular insufficiency is what you need to remember. And if you don't treat it, if the smoking is not stopped, it can lead to the development of gangrene is what you have to remember. A woman 30-year-old with Raynaud's phenomena, polyarthritis, dysphagia of 5 years, mild sclerodactyly, anti-centromere antibodies. With all these clues, you should be able to jump and answer. Shall we log the question? Yes. Very good. Satvik is right. Sanjay also gained 4 points. It is the crest syndrome which you need to classically remember for the tomorrow's NET PG. Calcinosis, Raynaud's phenomena, esophageal dysmotility, sclerodactyly, telangiectasia is the crest. Anti-centromere antibody positive, right? And there is esophageal dysmotility. That's the reason the patient can present with dysphagia. Anti-SCL70 antibodies will be positive, is what you should remember. Now, doctor, a laryngeal mask airway for securing the airway, all are true except indications of laryngeal mask airway is the favorite question of the examiner. Can you off this AC, please? Yeah, laryngeal mask airway. Who is going to give me the correct answer, doctor? Yeah. So you should remember Satvik, Manasa, Nitin, Chandani. All of you are right. Great. Whenever there is a large tumor in the oral cavity is absolutely right answer. Now, a supraglottic airway disease is laryngeal mask airway. It is contraindicated whenever there is any oral pathology like oral tumor. And during the CPR, when intubation is difficult, alternative device is laryngeal mask airway. And commonly it is used for short procedures. And which airway disease device aspiration risk is increased? Once more, laryngeal mask airway. It doesn't seal as tightly as endotracheal tube. Anterior uveitis. What is the earliest lesion, doctor? Good. Sanjay, Nitin, Chandani, Manasa, Satvik, I'm so happy to see you all. Please do come every day. And every Thursday and Sunday, we have a full scale grand test. And Monday, Tuesday, Wednesday, Friday, Saturday, we revise PYQs every day. And ultimately, by August, you should be ready to hit the examiner. So let us see, doctor, anterior uveitis. Good. Chandani and Satvik, absolutely right. Aqueous flare is what you need to remember. Aqueous flare. So the earliest sign of the anterior uveitis on slit lamp is aqueous flare. And inflammatory deposits on the corneal endothelium, they're called keratic precipitates. And if you don't treat the uveitis aggressively, it leads to synechiae. And why do you get the photophobia? Whenever uveitis is there, it is because of the ciliary muscle spasm, is what we have to remember. Now, Lamb syndrome is characterized with the presence of what? Oh, I think the options are wrongly framed. Lentiges, atrial myxoma, and blue nevi, right? So the frame was wrong. All right. Lentiges, atrial myxoma, and blue nevi is called as Lamb syndrome, is what you need to remember. Lamb syndrome is a variant of Carney's complex. And in this, what is the cardiac tumor associated? Atrial myxoma. And typically, whenever structural protein disorder, like the Lamb syndrome, inheritance is always autosomal dominant. Rate limiting enzyme disorders, autosomal recessive, is what we have to remember. What is the leading cause of death in adults? For the 2015 question, 10 years back, it was so easy question, right? Yeah, let's see. Good. Satvik rightly answered lung cancer. We don't know who gets what. Our environmental pollution with carcinogenic agents, very difficult to guess. The most common cancer death worldwide is lung cancer. And the major risk factor is smoking, either by oneself or by passively. And the most common histology, especially non-smokers, women, is adenocarcinoma. And it leads to SAADH as a paraneoplastic syndrome. And we use the low-dose CT as a screening test, is what we have to remember. Now, a patient after an accident was unconscious. There's a unilateral pupillary dilatation. And what is the reason for this unilateral pupillary dilatation? What is it localized to? Is the NEET PG favorite question. So, you should remember, whenever there is a uncal herniation, then that leads to. Good. Satvik, Nitin correctly answered it. Yes, doctor. So whenever head injury is there, ipsilateral dilated pupil, you should think of the compression by oculomotor nerve. And if the compression of the brainstem is not aggressively managed, unless you bring down the ICT, it can lead to the development of the death, because all the key centers are located in the brainstem, is what you need to remember. Now, doll's eye reflex. Where do you use, doctors? Doll's eye, you will be turning the head. If the eyes, when you turn right, do not move to left, and they move only with your head, doll's eye reflex, where conjugate movements are lost. So, where do we use it? Very good. Satvik is absolutely right. Typically, in unconscious patient, as a part of assessment, we use it. So, oculocephalic reflex is typically used to assess the brainstem. And unconscious intact brainstem is typically doll's eye. And if there is no doll's eye reflex, that indicates brainstem damage. Right? So that's the reason absent reflex is an indication of the brain death, is what we have to ultimately remember. Yes. Now, what is false about the declaration of the brainstem death in the hospital? Yes. Give me one confident answer, doctor. How do you declare the brainstem death in the hospital? NEET PG 2015 question. Yes. Sanjay, Nitin, Chandani, Manasa, Satvik, everyone who are all online? Yes. So, you should remember, good. Satvik and Manasa are closely trailing. It is brainstem death. A patient ICU with an absent brainstem reflexes requires confirmation by a neurologist. Before declaring the brain death, you need to rule out the causes of the reversible drug toxicity, especially barbiturate toxicity. You need to rule out. And it is the absence of the pupillary reflex which is indicative of the brainstem death. And apnea test is used to confirm the absence, is what you need to basically remember. Now, significant weight loss. When do you like to call this as? Keep answering, doctor. I'll just join you back. Keep answering. PDF of the 10,000 people of the reference PYQS. Can you please check which question number in the PDF? They are it. Yeah, welcome back to the session, doctor. The most common lung cancer in the non-smokers belongs to which histology was the NEET PG examiner's question? Yes, non-smokers, just before we discussed anyway. So, Satvik rightly answered, Manasa and Nitin, adenocarcinoma. 34th question. Now, if you look at most common lung cancer overall in non-smokers, it's adenocarcinoma. Squamous and small cell carcinoma are central, whereas adenocarcinoma is peripheral. And small cell carcinoma is the one which is associated with SADH. And tyrosine kinase inhibitors are the ones which are typically used to treat the lung cancers which are EGFR mutation positive is what you should remember. A patient has a difficulty with the swallowing of the liquids but not solids. What is the best investigation? Punch your answer, fast, fast, fast. Yes, doctor. Yes. Very good. Typically, we use the manometry, which is the gold standard. Only 2 of you rightly answered. So dysphagia to liquids more than the solids suggests motility disorder. And the gold standard is always the manometry. And the barium swallow shows bird beak appearance. And we do Heller's myotomy to treat the achalasia cardia. And the underlying histopathology is the failure of the lower esophageal sphincter relaxation is what you need to remember. Now, doctor. About the gastrointestinal carcinoid tumors, these are all true except ONK also came good. Please click on the video ONK for you to listen. Yes. Gastrointestinal carcinoid tumors. You are given only 20 seconds of time, doctor, to jump and answer. Yes, very good. Satvik is right. Sanjay also right. So you should know that appendiceal carcinoids are more common in females than in the males. So typically carcinoid tumors commonly arise from small intestine. They produce 5-hydroxy-indole acetic acid. Rectal carcinoids are possible, but they are small in size. And flushing and diarrhea are the classical features of the carcinoid syndrome because they release the serotonin is what you need to remember. So, ONK, can you please punch? Is the voice loud and clear? You have to click on the video, tap it twice for you to listen. Yeah. So ideally, if you attend from the desktop, you can see the panoramic view. Even on the mobile, it is okay, comfortable. Yeah, depending on your choice. ONK, can you please punch in the chat whether you are able to hear? Yeah. Now, let's see. At which cell cycle checkpoint is the cell's DNA is damaged? Come on, punch your answer, doctor. At which checkpoint is the cell's DNA is damaged? Oh no, Satvik, Manasa, Nitin, Sanjay, ONK, everyone clean bowl. So, you should know it is G2M. So, DNA damage checkpoint before replication occur is at G1S. Checkpoint before mitosis occur, G2M. And tumor suppressor gene involved in the DNA damage response is P53. And cyclin-dependent kinases, CDKs, are the ones which basically control the cell cycle, is what you need to remember. Yes? Now, let's go to the next question. In SVC syndrome, due to the non-small cell cancer, NEET PG 2016 question, how do you do the clinical management? Non-small cell cancer versus small cell. In small cell, there is no role for surgery because by the time you find only small cell carcinoma will metastasize. Chotu bhagega. So that is the reason there is not much of a role, is what you need to remember. Yes. Give me your answer, doctor. Let us see. Yes, Satvik is right. Sanjay is right. Yes. It is the radiotherapy, which is the treatment whenever SVC syndrome is there. So, immediate management of SVC obstruction is radiotherapy, and dilated chest wall vessels is a very important indicator of the superior vena cava syndrome, is what you need to remember. Right? Next. About the gallbladder carcinoma. What is a true statement? Gallbladder carcinoma. Another very favorite question of the examiner. Gallbladder CA. You can write it out in your hit list to revise. Sure short question to come. So you should know. Good. Sanjay correctly answered. CA gallbladder presents with jaundice, which is true. You thought everything is right. No. So what is the most common histology of the gallbladder cancer, doctor? Adenocarcinoma. Gallbladder cancer presents with jaundice. Prognosis is very poor. Gallstones for a long period of time is a risk factor for the development of the gallbladder cancer. And the biggest problem, gallbladder cancer presents very late. By the time it declares, already it is in the late stage. So that silent clinical course is responsible for poor prognosis. Right? So, what is the critical diameter of the cecum when perforation is considered imminent in pseudo-obstruction? 2016 NEET PG question. Come on, punch your answer, doctor. Critical diameter of the cecum where perforation is imminent. If you know, you know it. You don't know, you don't know it. Simple. So, Satvik is still right. Very good. More than 9 centimeters is considered to be the critical diameter of the cecum. Cecum bears the brunt. It will burst wherever be the obstruction. So acute colonic pseudo-obstruction is also called Oligivi syndrome. And the initial management is you need to do the decompression. And we use neostigmine in the clinical management of Oligivi. And if you don't treat the pseudo-obstruction, yeah. So Satvik says it's a tricky question. Yes. Good. So the complication of an untreated pseudo-obstruction is perforation, is what you need to remember. Complicated urinary tract infection. Right? When do you call it as? When the infection fails to resolve or recur. After a standard therapy, within how many weeks you call it as? The definition of it. 2016 question. So, Satvik is right. Very good. 2 weeks You need to basically remember to call it as a complicated UTI, right? Now, most common organism always is a gram-negative E. coli, and recurrent UTI बोलने के लिए 3 episodes per year होना चाहिए. And pyelonephritis is the upper urinary tract involvement. Yes, so we treat with intravenous meropenem. Tazobactam and piperacillin is the one which is being used in the treatment. Now, which nuclei belong to general visceral afferent column is a very important question. Yes. Shoot me, doctor. Manu, can you check question number? Huh? Time? Started time? So this is a favorite question both in anatomy and neuroanatomy, neurology, everywhere. Doctor, you need to be doubly sure. Yes. General visceral afferent. Satvik is absolutely right. So, good. It is the dorsal nucleus of vagus. Nucleus ambiguous contain brachial efferent. And the trigeminal nucleus carries somatic sensation. And what is the nerve, cranial nerve, that controls the visceral sensation of the thoracoabdominal organs? It is the vagus, is what you need to remember. All right. So there is one table of the list you need to master for the tomorrow's exam. Now, where do we do the burr hole? If it is an arterial bleed, if it is extradural, then burr hole has a role. Whereas subdural is venous bleed, not much. So, what is your answer, doctor? Very good. Satvik rightly answered. Whenever, oh, is it chronic SDH? Okay. A patient with chronic headache, altered sensorium with crescent-shaped hematoma requiring burr hole. Chronic subdural hematoma is common in elderly, and it is the bridging vein rupture that lead to subdural hematoma. And acute subdural hemorrhage is because of the middle meningeal artery involvement. A lucid interval is the classical feature of extradural hemorrhage is what we need to remember. Right? Now, what is the drug of choice for the palliative treatment of pancreatic carcinoma? Just before we finish this question, yes, let's see. So it is the gemcitabine is the one which is used as a drug of choice for the palliative treatment. So first line palliative chemotherapy of pancreatic carcinoma is gemcitabine. Pancreatic carcinoma most commonly come from head. And it is the CA19-9 which is considered to be the tumor marker. And a painless progressive jaundice is the hallmark of pancreatic cancer. And we do the Whipple's procedure, pancreaticoduodenectomy, to treat the pancreatic head cancer is what you should remember. An individual of the age 40 years presents with dysphagia for both the solids and liquids. And there's a chest pain, there's a weight loss. What is the preferred investigation to identify the pathology, doctor? Yes. Yes. So we need to do barium swallow and manometry is considered to be the gold standard for the diagnosis of achalasia. So frequently repeated. What is the definitive treatment of adenomyosis? How do you want to? So fibroid and adenomyosis. Favorite question of the examiner. Online score? Online score? Good. So every day evening 6 to 8 p.m. we have a PYQ Mela. So make it a point. We have a beautiful center here in Padmarao Nagar in Hyderabad. If you are in Hyderabad, please do come to the live class. Enjoy. Good. Manasa missed it. Nitin and Satvik rightly answered. So it is the hysterectomy which is considered to be the management of choice. Whenever there is any dysmenorrhea with an enlarged uterus with an ectopic endometrial tissue, you call it adenomyosis, and we need to do hysterectomy. And if you need to medically manage, all the ectopic endometrial tissue survives with the support of the estrogen. That's the reason hormonal therapy is the management. Commonly, it is the multiparous women who are victims of adenomyosis, right? And whenever there is an ectopic endometrial tissue outside the uterus, you call that as endometriosis, which you need to differentiate. Apnea, hypopnea index indicating obstructive sleep apnea. How much is it, doctor? You are only given 15 seconds of time to answer. Punch your answer. Because this is, after all, a numerical, favorite numerical 2016 exam. Because obstructive sleep apnea is the favorite topic of the examiner. Right? Now. Good. Satvik missed it. Sanjay missed it. Right? So it is less than 1 apnea, hypopnea index, which indicate obstructive sleep apnea. So we do polysomnography and they have a fragmented sleep. All these points need to be remembered. We already discussed it. Cetuximab is used to treat which condition, doctor? Cetuximab. Yeah. So one monoclonal antibody is a favorite question of the examiner. Yeah. So cetuximab, where do we use it? Yes. So Satvik is once more right. Colorectal cancer is the place where you use the cetuximab. It targets the epithelial growth factor receptor and KRAS mutation is an important predictor whether cetuximab resistance will be there, right? And commonly it is the liver to which colorectal cancer metastasis is what we need to remember. Now, doctor, what is the preferred route of access of the total parenteral nutrition in a patient who requires the same for less than 14 days? And there is otherwise no indication of central catheter. What is your answer? Yes. Good. So you should know Satvik is right. Peripheral vein. Peripheral vein is the way which you need to remember. So short-term parenteral nutrition can be given by peripheral vein. Only if you require to sustain the parenteral nutrition for more than 2 weeks, then central venous catheter. The main challenge is infection. And why you can't use peripheral vessel? Because the total parenteral nutrition is a very highly osmolar substance. That's the reason you can't use a peripheral. right? Nice to see Shama Begum Syed. Excellent, doctor. Thanks for joining the session. Punch on the video, Shama. Then you can, Shama, you need to punch on the video, tap. Then you can listen the voice. Can you please punch the voice loud and clear for you? Yeah. So, hoarseness of the voice in lung carcinoma is because of what? Hoarseness. So you should know, Satvik is right. Recurrent laryngeal nerve is the one which decides. So, left recurrent laryngeal loops around aortic arch, and any tumor at the periphery, I mean the lung apex, leading to compression is Pancoast tumor. And whenever recurrent laryngeal palsy is there, where will be the vocal cord position, doctor? Typically, it is paramedian. And when bilateral recurrent laryngeal is involved, that lead to development of the airway obstruction. Thank you, Suresh. Now, let's go to the next topic. Apnea, hypopnea index. See how favorite question of examiner it is. Typically, it is used for apnea, hypopnea index. Shama Begum, can you be able to hear the voice? Please punch in the chat. You have a chat also available for you, right? Yeah. It is used for what? Apnea, hypopnea index. It is used for? Yes. So, most of you correctly answered obstructive sleep apnea. So, whenever apnea, hypopnea index value more than 5 is obstructive sleep apnea, gold standard is polysomnography. These are the two essential points you need to remember. Now, 40-year-old male with a pain in the loin since 1 month. And what is the etiology? Yes. Pain in the loin. Yes, let's see. Very good. Satvik, Nitin, Sanjay, right? It is a ureteric calculus which can present with the pain in the loin is what you need to remember. Right? Yeah. Nice to see Dr. Naima Khatun. Very good. Very good. So please do come every day evening. We will discuss for a couple of hours the PYQ marathon, right? So typically you need to do CTKUB, which is the investigation of choice. And it is the uretero-vesical junction, most common site for the ureteric stone. And the calculus can present with even hematuria. Now, what is the GCS of a 25-year-old? Confused, opening eyes in response to pain, localizing the pain response. So one MCQ on the GCS scoring, Apache scoring. Similarly, child pukes classification scoring. So one scoring based MCQ is sure shot in the NEET PG exam, doctor. Yeah. So what is the online score? Good. Satvik is standing at 151 points. Excellent, doctor. 9. Okay. So a patient open eyes to pain is confused, localizes the pain. 11. Eye opening is 2. Verbal response, confused, corresponds to 4. Motor response, localizing the pain, 5. So minimum is 3, maximum is 15. So the GCS you need to be doubly sure about, doctor. Now, let's see. Siemens squeeze technique typically is used for which condition? It is being authenticated by Masters and Jones, which is the popular book in sexology, Siemens squeeze technique. So the partner typically squeezes to prevent ejaculation. So it's called premature ejaculation. Siemens squeeze technique is what you need to basically remember. So a noxious stimulus will make the person to stop from ejaculating. So it's a behavioral therapy. And often the premature ejaculation is because of anxiety. That's the reason selective serotonin reuptake inhibitors like escitalopram, sertraline, they also have a role, and you need to be very sure, doctor. Now, what is the characteristic pattern which you see in Brown-Sequard syndrome, where there is a hemisection of the spinal cord? Yes. In Brown-Sequard syndrome. So let's see. Very good. So there is a contralateral loss of the pain because spinothalamic tract undergoes the decussation. That's the reason there is a contralateral loss of pain. So the pain and temperature loss is contralateral, motor weakness is ipsilateral, and dorsal column is the one which brings the proprioception. And the level of the lesion will make you know where was the hemisection is what you have to remember. Heller's myotomy is done whenever there is any. What is the condition, doctor? Quickly punch your answer just before we discussed. So it is the achalasia cardia where you do Heller's myotomy. Now, 25-year-old head injury, confused opening eyes in response to pain and localizing the pain. How do you compute? So GCS scoring computation is the favorite topic of the examiner, right? So you should remember that the most important thing, how to calculate the GCS score. It is 11. So, eye opening to pain, 2. Confused verbal response, 4. Localizing pain, motor response, 5 is what you have to remember. And any GCS score of 11 indicates moderate injury in terms of severity. Now, trolley, that is transfusion related acute lung injury. How many hours after the transfusion does the trolley happen? And all differences between trolley and the other complications of the transfusion, like a mismatched transfusion, you should know the differences, right? Now, so typically it is after 6 hours, trolley typically happens. So doctor, trolley presents with dyspnea. Trolley is an immune response against leukocytes. There is a pulmonary edema on the chest X-ray. Mainly you need to give supportive therapy to treat the trolley is what we should remember. Indole acetic acid, HIAA, is typically present in which syndrome, doctor? Easiest question. 2018 wala question. So you should know it is the carcinoid where hydroxyindole acetic acid is being presented. The most common site of the carcinoid tumor is ileum, is what we have to Remember emphatically for the tomorrow's exam. DVT, what is wrong about DVT? Yeah, I'll give you only 10 seconds time to answer very fast. Rapid answers you need to give. Yes. So, Sanjay, Nitin are right. So, it is often a unilateral. It presents with hormone sign positivity, which is the pain in the tenderness in the calf, is what you have to basically remember. Right? Then gold standard imaging in DVT is Doppler anyway. Now, screening is not of any use for which malignancy, doctor? For which cancer it is not useful? Yeah? So, you should remember, testicular tumor, there is not much of a role for screening because it has low prevalence and good prognosis, no role for screening. And screening is very good for breast cancer, mammography, colon cancer, colonoscopy, PSA for prostate cancer. And whenever testicular cancer presents, it is the painless mass which is considered to be the most common presentation. Yeah. Now, esophageal manometry was performed. It revealed paraesophageal pressurization with a distal contractile integrity more than 450 millimeters pressure in the body. What is your diagnosis, doctor? Yeah. So you should know this entity, type 3 achalasia. Still, Manasa and Sanjay are lucky to answer this question. I'm surprised. So, high amplitude contractions more than 450 in esophagus is type 3 achalasia. Type 2 achalasia shows paraesophageal pressurization. Type 1 is minimal contractility. And jackhammer esophagus is associated with hypercontractility. So these are the few things on classification you need to be very sure. Transplantation between the identical twins is called as? Yes, easy question. Identical twins. So it is called as isograft. So these definitions are important. Genetically identical individuals is isograft. Different species is xenograft. You bring pig heart and put in human heart. Rejection is very minimal for isograft, which is being done between genetically identical twins. Then, 4 hours after having a clean wound without laceration, he has taken TT 10 years before. What is the next step in management? So, tetanus vaccination is the favorite question of the examiner, doctor. Yes. Question number? Yeah. Now, let's see what's your answer. Good. 10 years before, that's the reason, single dose TT is important. A clean wound with the last TT taken more than 5 years ago requires single dose of TT. And how many doses are there in tetanus immunization? 3. And whenever it's a dirty wound, immediately you need to provide protection. Hence, you need to give passive immunization with the tetanus immunoglobulin and lockjaw is the feature of tetanus is what we have to remember. Nutcracker esophagus. What is the true statement about nutcracker esophagus? Let's start. Nutcracker esophagus. Yes. So there are forceful peristaltic activity leading to episodes of chest pain and dysphagia is the feature of nutcracker esophagus is what we have to remember. So how do you treat it? We give calcium blockers. And it is a functional disorder where there is a hypercontractility is what you should remember. Now, postmenopausal women, what is the first line treatment of osteoporosis, doctor? Yes. Postmenopausal women. Now we are using denosumab, 60 milligrams subcutaneously to treat the postmenopausal osteoporosis for that matter. Yes. So let's see. It is a biphosphonates, but in practice, what we use is once in 6 months of denosumab will really help. Biphosphonates mechanism, they inhibit the osteoclast. Alendronate is used, and what is selective estrogen receptor modulator, which is being used, raloxifene, is what you need to remember. Now, CA125 is a marker for screening of ovarian cancer. So, let us say 60 by 100 tested positive and they have ovarian cancer. 20 by 100 tested negative, also had ovarian cancer. So you should know true negatives, true positives, false positives, and calculate the negative predictive value of the test. So let us see how many answered correctly. Good. Satvik correctly answered as 80 by 100. So, negative predictive is defined as the proportion of true negatives. True negatives divided by true negatives plus false negatives, all negatives. And a high negative predictive value rules out the hypothesis. So these are the points that you need to remember. And also, a screening test mainly depends on prevalence, will decide the effectiveness of the screening test. So in the Torreco score, which is not a component, 2020 question, NEET PG. Yeah. So you should know surgery priorities are not part of the Torreco score, whereas expected complications, performance status, etc. So Torreco score is used to predict the outcome of the surgical mortality. And ASA assess the anesthetic risk. Performance status is measured using the ECOG. And these are the points you need to remember about the Torreco score. Now, history of carcinoma, gallbladder, dyspnea, clinical signs of DVT and tachycardia. According to the Wells score, what is the chance of pulmonary embolism in this given case? Wells score, you need to be doubly sure. Yes. So, according to that, it is medium in this given case, right? So, cancer and DVT increase risk category to moderate. And whenever there is a high Wells score, it's an indication for CT pulmonary angiography. And D dimer is the one which is used to screen if it is a Wells score low risk operation, is what we need to remember. Now, at high altitude of 3000 meters, a person complains of breathlessness. So, how do you manage this individual? Yes. Shoot your answer, doctor. How do you manage at 3000 meters? So, we give oxygen supplementation, IV digoxin, acetazolamide, which is a carbonic anhydrase inhibitor, not an immediate descent, right? So, as a prophylaxis, one of the severe complications is the cerebral edema in case of the high altitude sickness is what we need to remember. Now, what is the T stage in 2.5 centimeter lung carcinoma, which is not involving the pleura? Keep answering. I'll just join you. So, welcome back, Doctor. Gersman syndrome. What is all the combination of the features that we see in Gersman syndrome is a question to all of you. Yes. So, very good. Sanjay, absolutely right. Acalycia, agraphia, agnosia. Yes. So whenever there is any dominant inferior parietal lobule lesion, patient has got a finger agnosia, right-left confusion, agraphia and acalycia, which is called Gersman. And it is the angular gyrus area 39, which typically produces a cluster of these disturbances in case of Gersman syndrome. Whenever there is any preserved language comprehension and production, but impaired calculation and writing, then you think of dominant parietal lobe. Anomial aphasia is typically a lesion in which area, doctor? Yes. Punch your answer. Anomial aphasia is due to the defect in which area? So you should know. Good. Satvik and Sanjay rocking the game. Temporal occipital is the defect in anomic aphasia. So the patient is having fluent speech with preserved grammar, but severe difficulty in naming the objects. Then the lesion is in temporal lobe. So posterior temporal occipital area causing word finding difficulty is called anomic aphasia. Then let's go to the next question. A patient with native aortic valve disease develops right hemiparesis. How do you prevent a future stroke? 2012 question. Yes. So we need to know that we give one dose of low molecular weight heparin subcutaneously followed by dual antiplatelet therapy is considered to be the management. So whenever there is an ischemic stroke, to reduce the recurrence of an ischemic stroke, we give double antiplatelet therapy as a secondary preventive mechanism is what you should remember. Lateral medullary syndrome of Wellenberg, 2012 question. So stroke is, without stroke, there is no question paper. You can take it granted. So, lateral medullary syndrome of Wellenberg typically is caused by thrombosis of, yes, I'm sure many of you will correctly answer. Satvik did well. So, it is posterior inferior cerebellar artery, which is also the branch of the vertebral artery. So, either of them can lead to the development of lateral Wellenberg syndrome, where the lateral part of the medulla is affected. In lateral medullary syndrome, where there is an ipsilateral facial pain and temperature loss, dysphagia, hoarseness, and contralateral body pain and temperature loss. The contralateral body pain and temperature loss typically is PYQS, posterior inferior cerebellar artery. You should know what is the territorial distribution and what is lost in case of lateral medullary syndrome. Ocular bobbing is typically a feature when which part of the brainstem is involved, doctor? Yes. So you should know, typically the ocular bobbing is a feature which is seen whenever there is any pontine involvement. So a comatose patient who is showing rapid downward jerk of the eye and a slow return upward, which is called ocular bobbing, is a lesion in pons, right? So pontine lesion is what we need to remember. Now, about central nystagmus. What do you want to remember, doctor? Central nystagmus. Yes. So, typically, it is not suppressed. It is suppressed by optical fixation. Is wrong. It is not suppressed. So, whenever there is any brainstem lesion with nystagmus that changes the direction with the gaze and is not suppressed by fixation, then it is central. Nystagmus that is vertical or purely torsional, not suppressed by fixation, is typically central, and not being suppressed by fixation is the hallmark of the central nystagmus, is what we need to basically remember. Now, bilateral past pointing. Bilateral past pointing is the defect in which part of the brainstem? Yes. So, doctor, it is the vestibular system defect that lead to bilateral past pointing. So, a patient demonstrate bilateral overshoot on finger nose testing, which is called past pointing, with the finger to touch the nose. And that is worse by closing the eyes. Then you need to think the problem is in the vestibular pathways. So bilateral past pointing with the impaired head and eye coordination suggests the dysfunction of the vestibular pathway is what we need to remember. Now, whenever the lateral part of the medulla is involved, lateral medullary syndrome of Wellenberg, what all the things that will come just before we have discussed this, doctor? Yes. So you should know ipsilateral horner, nystagmus, dysphagia, they're all the things that need to be remembered. Now, hemorrhagic stroke. What is the drug which is being implicated responsible for hemorrhagic stroke? It is actually a very simple drug, commonly used in the cold medications. Yes. So you should remember phenylpropanolamine is the one which can lead to. So it is a vasoactive sympathomimetic formerly used in the cold medicine that is known notoriously to lead to intracerebral hemorrhages and hemorrhagic stroke is what you need to remember, doctor. Now, subclavian steal syndrome. Where do we see subclavian steal syndrome? What is the underlying pathophysiology of subclavian steal syndrome? Right? Where there is a claudication whenever you are raising the hand. Typically, where do we see? Yes. So, it is the reversal of the blood flow into the ipsilateral vertebral artery which is responsible for the subclavian steal syndrome is what you need to basically remember. So whenever there is an occlusion of the proximal part of the subclavian artery, proximal to the vertebral origin, it causes the reversal of the flow, which is responsible for the ipsilateral vertebral artery lesion is what you need to basically remember. Right? So, next. Downbeat nystagmus is typically a feature which is seen whenever there is any lesion in the downbeat nystagmus. So you need to be very sure in neurology, favorite questions of the examiner, right? So you should know. Very good. Satvik and Sanjay are rocking with the correct answer. Cerebellum is the one which is associated with downbeat nystagmus is what we should remember. So whenever the person makes a downward gaze and head extension, there is a worsening of the downbeat nystagmus, which is the feature of cerebellum involvement. Whenever there is any lesion in the craniocervical junction, right, or in the cerebellum. Similarly, Arnold-Chiari malformations are also associated with downbeat nystagmus is what you need to remember. So, the vertical nystagmus with a downward fast phase is the feature whenever the brainstem is involved. Now, out of all these, which one you don't like to call and define it as a stroke, doctor? Typically, yes. TIA, subarachnoid hemorrhage, intracerebral hemorrhage, they are all the different part of the spectrum of the stroke, as you already know very well, right? So, any transient neurological deficit lasting less than 24 hours is the definition to call it as the TIA is what we should remember. Downbeat nystagmus, once more, favorite question of the examiner, just before we finished it. So typically it is seen in the case of the Arnold-Chiari malformations, where you can see the downbeat nystagmus is what we need to remember. Now, which is not a sign of the upper motor neuron paralysis. So you need to know what are the lesions that lead to UMN palsy and which appear in the LMN palsy. Yeah. So you need to be very, very clear, doctor. Nice to see Sai. Sai also can answer. Yes. Hope you are able to hear my voice. Tap on the video. If you're on mobile phone, tap on the video. So, the presence of fibrillation potentials and positive sharp waves on EMG indicate denervation, right? So, increased tone, hyperreflexia, Babinski, denervation on EMG, they're all the features of the upper motor neuron lesion is what you need to basically remember. Now, distribution of the weakness whenever there is any pyramidal weakness. Is it there more on the extensors or on the flexors? Is it more in the upper limb or in lower limb? How is the pattern? How would the decorticate rigidity, decerebrate rigidity, how do they look like? You need to be very, very sure about. So, doctor, distribution of the motor weakness is typically the anti-gravity muscles are spared. It's very important to remember. So, in pyramidal tract lesions, UMN lesions, anti-gravity muscles are spared. And typically, decorticate versus decerebrate rigidity is the favorite area of the examiner. Now, aphasia, which affects the arcuate fibers, is called as what type of aphasia? Right? So, aphasia that affects the arcuate fibers. So, arcuate are the ones which are connecting your Broca with the Wernicke's. That's the reason it is the conduction aphasia, which is because of the involvement of the arcuate fibers, is what we should remember. So, a patient who has got a fluent comprehension but markedly impaired repetition is a typical arcuate fasciculus lesion, is what you need to remember. Whenever there is an isolated impairment of the repetition with the preserved comprehension, that is the clue to say that it is conduction aphasia. Now, doc, Broca's aphasia versus Wernicke's aphasia. You need to know the difference, right? So, Wernicke is a fluent aphasia, jargon aphasia, whereas Broca's is a non-fluent aphasia, because Broca's is the motor speech area, is what you need to remember. Good. Now, it is the lesion of the dominant inferior frontal gyrus area 44 and 45 that lead to the development of the Broca's aphasia. So, motor speech production is impaired, but there is a preservation of the repetition, is what we have to basically remember whenever it comes to the Broca's aphasia. Now, herpes simplex infection typically involves, oh, this is an easy question, we already finished it. Keep punching answers quickly. Temporal lobe infarction. Typically, temporal lobes will suffer from hemorrhagic infection. Hemorrhagic encephalitis is what we need to remember. It is the HSV1 that lead to encephalitis. HSV2 is below the belt. HSV1 above the belt. Right? Now, fluent aphasia with a preserved comprehension and impaired repetition. Favorite question of the examiner. So where do we see that? This already came many times. Fluent aphasia means Wernicke's aphasia. Yeah, good. You need to keep on punching very fast answers. So a patient with fluent spontaneous speech, intact understanding, but poor repetition, localizing the lesions to arcuate lesions, conduction aphasia, right? Now, target BP before thrombolysis in ischemic stroke. How much should be the blood pressure? So, we need to remember 185 by 110 is considered to be the target blood pressure. So, according to the thrombolytic guidelines, maximum allowable BP prior to giving the alteplase is 185 by 110 is what we need to remember, the golden figure. Rupture of the berry aneurysms is the underlying cause that lead to the development of the subarachnoid hemorrhage, as all of you know very well. The most common site of cerebral infarction typically is in the middle cerebral artery territory, right? So, middle cerebral artery territory, most common location. And dominant hemispheric MCA infarction is the one which lead to development of the aphasia, right? Now, most common site of the berry aneurysm to rupture, another favorite question of the examiner, is the anterior communicating artery, which is the anterior circulation is the most common site where the berry aneurysm ruptures and leads to development of the subarachnoid hemorrhage. The most common cause of an embolic stroke typically originates from the intracardiac thrombi. This is a rapid fire session. Keep punching answers in less than 5 seconds, doctor. Right? Now, Brodmann's area, which is associated with the motor speech, is which one? Brodmann's speech area. Right? So, it is the area 44. Satvik rightly answered. I'll only give you 5 seconds time to answer fatafat. So, Broca's area is classically located in the dominant hemisphere in the area 44 is what we need to basically remember. Now, Broca's area is concerned with what? Wernicke's comprehension. Broca's is the one which is the motor speech area. That's the reason it is associated with the word formation. Now, which one can give whenever there is any hemorrhagic stroke? Hemorrhagic stroke. Yes, easy question. So, we need to know it is a normal saline, right? Is the fluid of choice in the acute management of intracerebral hemorrhage. Isotonic fluid is the one which is preferred. That's the reason we give the normal saline. Lateral medullary syndrome of Wellenberg is because of the posterior inferior cerebellar artery or vertebral artery, not posterior superior, posterior inferior cerebellar artery. So you should know all these arterial territories, doctor, how frequently examiner asks the questions. Right hand dominant patient presents with a normal comprehension, but speak with short utterances. Interrupted. Broca's aphasia. Frontal lobe is the one which is involved. So that is the reason you need to remember. It is the left inferior frontal gyrus, which is the dominant hemispheric Broca's area in a right-handed individual, is what we need to basically remember. Now, global aphasia is because of what? Global aphasia. So whenever the stroke is involving the entire middle cerebral artery distribution in the left hemisphere, you call it as global aphasia. Which cranial nerve is involved in the Weber syndrome where the midbrain is involved, doctor? Midbrain gives rise to third and fourth cranial nerves. That is the reason you need to remember that it is the oculomotor nerve which is arising from the midbrain is the one which is involved whenever there is the Weber syndrome is what we have to remember. So contralateral hemiparesis with ipsilateral oculomotor palsy is the Weber syndrome. Pure word deafness is associated with pure word deafness is typically the feature which is seen in the case of the middle cerebral artery stroke is what you need to know. A patient who cannot understand the spoken words but can read, write, speak the words produced by themselves is having a lesion in middle cerebral artery. It is because of the bilateral temporal lobe auditory cortex involvement in MCA strokes. You get pure word deafness is what we have to basically remember. So in MCA stroke, why do we get this? Because of the Herschel's gyrus involvement is what we need to basically remember. So, doctor, with this, we call it a day. And thank you all for participating. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे. And totally 10,000 PYQs are there. I will give you the PDF, topic wise classified, and every question is followed by 5 potential questions that can come in the future. That way you will cover all the examiner's favorite areas and get ready for the tomorrow's exam. Good luck, and please do come for the tomorrow's session, right? Thursday and Sunday we have a full-scale grand test and discussion, and all the remaining days we will spend in doing the revision of the PYQs. Good luck.